Thank you so much, everybody, for joining us today. We are thrilled that you're here with us. September is Gynecologic Cancer Awareness Month, and this is going to be a panel discussion on the psychosocial implications of a gynecologic cancer diagnosis. My name is Rachel Justus, and I'm the co-manager of the Woman to Woman Gynecologic Cancer Support Program. Our program is geared to support women however we possibly can during their gynecologic cancer journey through emotional support, through education, and through financial resources. Today we have a fantastic panel that's joined us, and I will let them introduce themselves now. Julian, why don't you start?
Sure. Hi, I'm Julian Levinson, and I co-manage the Woman to Woman program with Rachel. I've been an oncology social worker at Mount Sinai for 10 years. And prior to joining Woman to Woman, I was the gynecologic oncology social worker, so the primary social worker for women with a gynecologic cancer.
Thank you so much. Trisha, how about you next?
Hello, my name is Trisha Clark, and I've been a volunteer with Woman to Woman. This year will be 8 years, and I've had very fruitful relationships exchanging my experiences with these women. So I'm really looking forward to today.
Thank you so much, Trisha. And last but not least, Amanda.
Hi, good afternoon, everyone. My name is Amanda Fitzpatrick, and I am a two-time cancer survivor of endometrial cancer and the ambassador for Women's programs and organization. I love the program. It is a wonderful program to be a part of. It has helped me in so many ways with sharing my story and, just becoming a better person while managing cancer and having history with cancer and anything that has to do with cancer. I owe it all to you guys because you guys opened me up to not feel so alone with having cancer, and I'm just so thankful and grateful for this organization.
As you can tell, Amanda is a wonderful ambassador for our program, and that was actually a great segue for us. So just to give you an idea of what this panel is going to be like, we're going to talk about the psychosocial implications of a gynecologic cancer diagnosis throughout the different stages of a cancer journey. So first, we'll talk about what it's like upon diagnosis, during treatment, and then at the completion of treatment and beyond. So Amanda, that was actually, as I mentioned, a really good segue. Can you tell us what it was like when you first heard the news that you had cancer? You were very young. If you could share what your age was and what it felt like for you.
Okay. I was actually on vacation when I found out. I was at Disney World and got a call from the doctor after trying to locate them, because it was during the holiday. It was exactly the day after New Year's Day of 2014. So January 2nd, 2014 was when I actually heard from the doctor, and he told me at 3:36 p.m. that I had cancer, and my heart was just on the floor. And as I looked over the balcony, he said to me, first, go to a secluded area and just have a seat because I have something to tell you. And I'm like, what could it be? It must be something serious because no doctor's ever told me that ever in life. I mean, let alone a cancer diagnosis is not even supposed to be done over the phone. But he said, I know you're on vacation and I need to tell you this. And he says at 3:36 p.m. that you have cancer. So the heart is on the floor. I look over the balcony and it's like raining after a fun day at Disney World. It was like a bucket of water, like Niagara Falls. And I didn't know what to do, but I just went into, after calling parents and family to kind of let them know what I just heard, prayer. And prayer really helped me, along with one of my close friends. She was actually there with me with the diagnosis. Now she's like my sister. She helped me so much, but we went straight into prayer and we prayed. And then after that, I know I paced around the hotel, and next thing you know, I was on my way to the airport. It was just like that quick. Like I was on my way to the airport. I had an extra day at the resort to be at. It gave us credit. So I left. Like I left straight to the airport, and my friend's cousin works at the airport, so she got me on the last JetBlue flight to New York, and it's midnight by now. And after it being midnight, we got on the last plane, and all I remember it being a blizzard in New York, and I must have got home at like 5 in the morning. After that, I was on the phone with my mom for like 2 hours, and then 7 o'clock came. All I remember was seeing Mount Sinai E-level. I don't know how I got there. I must have ran from home, but I was just there at 7. And my doctor's name at the time was he was an Asian doctor. It was a guy's name. I can't remember his name right now, but he was an Asian doctor at the E-level at Mount Sinai. So he spoke there. My aunt and a few cousins came to meet up with me and be of some sort of support because my mom couldn't make it. And they told me that I had cancer, and then that's when I realized it was a reality. Like it was really reality. Like I'm sitting in the office in the room, and my aunt, a cousin, and we're just like, oh my God. And so I kept saying, like, I don't have cancer. Cancer has me. Like that was my motto throughout the whole treatment of it. And I was just told to take 2 pills, which was called Megace. And it's just 2 big white pills. And I took that for 11 months. And on November 6th at 9:59 in the morning, I went back to for a general checkup to make sure the cancer didn't come back. And they told me the best news ever, that cancer was gone. I was so excited. I couldn't contain myself. I was excited. That was the best day of my life, just to hear that I didn't have cancer anymore. And I was just excited. I don't even think I went to work that day. I was just happy. After that, I was told just to go to the doctor every year to see if you had cancer again. And unfortunately, I was going for 4 years and everything was great. No cancer, no evidence of cancer. So I'm really excited, really confident, and everything was happening. After the 5th year, I go back and we do the same thing as a regular, do a biopsy, get checked out, and this time it came back positive. Now, my doctor, Monica Prasad Hayes, has always told me that if it comes back positive, we may have to do a hysterectomy. So she kind of like got me prepared, but I always had it in the back of my mind, like I wasn't going to get a hysterectomy. Like, no, that's not me. I'm not the one. No. So on December 11th, I had the biopsy. December 19th, of 2019, I was told I had cancer for the second time. And I was just nervous. I was upset. I'd done everything I was supposed to do, took my medicine on time, like clockwork. I was regular, happy but sad. And I'm like, oh my God. So now here it is. Dr. Monica Prasad Hayes says that I have to have a hysterectomy. And it's like fairly fast. Like there was not even time to think about it. It was during the holiday that I'm going to tell the family that I have cancer again for the second time. I am like so nervous of what people are going to say. Like I lost friendships. I've lost sisterhoods, closeness with people just because I was coming along to tell them that I had cancer for the second time. I'm not sure if that's something that they had to deal with, but the fact that they came to me and told me in my face, like they didn't really want to support me or they didn't know how to support me in any way after telling them that I had a cancer diagnosis for the second time, we still just haven't spoken since then. What else? So on February 24th of 2020 was when I officially, made up my mind. I'm going to have the surgery. This is what it is. After carefully, going to the family, getting their support here and there, trying to figure out what life would be like without a specific organ that kind of made me who I am today was, kind of hard to deal with because it's like that organ is what made me. So it's like it's leaving my body. But, thank you to you guys. You guys made it so much easier for me to deal with and accept and to, learn that I'm okay without the organ. It doesn't make me as I thought before. It's just something that was a part of me. And that's about it. Now it's 2 years dealing without it, and I'm great. I'm in great health. No more pills, no more cancer, no more radiation, no chemo. I've never had chemo or radiation. I was really against chemo and radiation. And that's it. I'm happy now. We clear almost 3 years in February.
I'm so glad to hear that you're doing so well after everything you've been through, Amanda. And would you mind just sharing how old were you when you were first diagnosed?
26.
Great. And I think that's really important, because I think a lot of people think of, especially gynecologic cancer, as a disease that affects mainly older women. But I think the image of you, 26 years old, at Disney World, is different than what a lot of women would expect. So bring up a lot of really important issues, the fact that your diagnosis changed your relationship with a lot of people in your life, the fact that you had to go through physical changes that maybe, were unexpected, especially for a younger woman. I'm sure there were implications of that in terms of body image, in terms of dating, in terms of your social life. So I think you really bring up so much. We're going to actually go now, and you kind of led us into the during treatment part of things. And we'd love to turn to Trisha right now. Trisha, as a mentor with Woman to Woman, you get matched with women who are diagnosed and actively in treatment. And I'm wondering if you could share some of your experiences working with women who are in active treatment and the psychosocial issues that might come up for them. And also, if you could let us know what inspired you. You went through everything that Amanda did. What inspired you to become a mentor and play this role for women?
Mm-hmm. Thank you, Rachel. I'm this year, I am already a 12-year survivor of uterine cancer, and as I shared in the beginning, I've been a mentor for 8 years, and in that time, I've been matched with women of different ages who've had different experiences. And I think, Amanda, you really hit on what the main issue is and has been for us and for women who've had a hysterectomy. But with any gynecological cancer, the main psychological issue has to do with identity. What does it mean to be a woman? What does it mean to have this diagnosis and be a woman? So it sort of readjusts our perceived perceptions of what it means to say I'm a woman. And we think that, like you mentioned, Amanda, that sometimes it's an organ, or it's the ability to have children, it's the ability to function in the world in a certain way. So most of the women that I have spoken to have shared this. Some of them have shared that this has been one of the main areas. Another related issue has been around just beauty. It sounds, initially on the surface, it sounds like it's a shallow thing, but it really is important to us. We care about how we look, but we also care about how we're perceived in the world. We want to feel like we have our hair, we have eyebrows, we have eyelashes. And when some women are undergoing chemotherapy, by having the chemotherapy, we lose hair and everywhere. And so it's looking in the mirror and seeing what feels like a bare face, right? There's really nothing to do. At that time, for me, at the time, it felt like there was nothing to do. With women today, there's that initial shock. There's that initial, where's my hair? Am I beautiful? Will I be beautiful again? And I would say the third area has to do with if women are in the working outside of the home. The third area would be, how does one function in the workplace? Do I share with coworkers? Who do I share this with? Do I have to let my boss know? Do I have to confide in someone? Do I have to share everything? So as you can hear, it touches on every aspect of who we are. So first, identity internally, then second, how we're perceived, third, how we function in the world. I would say foundationally, those are the three main areas And I'd also like to touch on the last piece I'll touch on, that the women I've spoken with have shared is around family. And Amanda, you've also touched on this, which is, to what extent do I share with family? Some women have support from family and close friends, some don't. And so our interactions lead into that, which brings me to why I've wanted to be a mentor and why I was very excited to become a mentor. Is because it's not because our type or gynecological cancers mean that it's not something that you talk about readily. It's very personal, because it feels like it's a body part that's hidden. So it's really important to speak to people who have been through, who've walked the walk, who have a personal understanding of what it means to experience this. And it has helped. I have felt fulfilled in sharing with women who are at the beginning. Sometimes it's difficult. I'm not going to say it's easy to share, because at each sharing and at each exchange, it brings it back up for me every single time. But at the same time, it gives me the opportunity to share, because in sharing, we create a sisterhood, and it then creates a community, which then connects back to the community of woman to woman. And I have to say, being a mentor with woman to woman, I feel supported from woman to woman leadership in Rachel and Jillian, and in the community of women who are part of woman to woman. And I also learn from patients themselves, I have to say, because they have shared, in sharing themselves with me, one, I think it takes courage. And two, I also learn about their own strength, their own resolve, their own desire to reflect and think about where they are now, and we can talk together about where they can be in the future. So I really think it's a special opportunity.
Thank you so much, Trisha. That was so beautifully stated. And I think you really explain how you are using your experience as a former patient, as a survivor, to support women as they go through these different stages, that you can really relate to it. I like especially what you talked about, that feeling of being bare when you look in the mirror, that it's not just your hair that's gone, but it's someone looking in the mirror that you don't even recognize, and how you feel vulnerable that way. So that was really, really helpful, shedding some light on common psychosocial issues that women who are going through treatment might feel. We're going to actually turn now to the post-treatment phase. I know there's this perception that when treatment is over, that, okay, there's this big weight lifted, but as we'll hear, that's not always true. So Jillian, would you talk a little bit about what you've seen, common issues that you've seen psychosocially for women as they finish the end of their active treatment?
Sure. So post-treatment can be a challenging time for women. And a lot of the themes that Trisha spoke about can continue into the post-treatment. Fear of recurrence is a very common theme for women. And these fears can be heightened prior to scans and follow-up appointments. And that's something called scanxiety. And it's very common. Another psychosocial issue that comes up for women post-treatment is that oftentimes social supports are ready to move on once a woman is done with her treatment. And they don't understand that the woman might not be physically or emotionally ready. And that woman might not be the same as she once was. After cancer treatment, a woman's body is changed, and body image and self-esteem can be impacted. And so, I know Trisha spoke a lot about that, and that can really continue. Hair sometimes for some women doesn't come back, or it comes differently. There's scars, there's losses, as Amanda spoke about, of loss of body parts. And you're just not the same person that you were before that diagnosis. Fear or pain during intimacy is also very common for women post-treatment, and that might be something that partners are not ready for. Some women might not be able to engage in the workforce as they previously did. And this change in the workforce is a psychosocial issue that has concrete implications, such as financial and emotional implications for the woman. Another thing can also be post-treatment that maybe the woman is not physically ready to take on the household duties that they once did. Maybe they can't do the child rearing, that their role that they had before. And that might not be something that the family unit is really prepared for.
Thank you so much. I think that that's really helpful because, again, I think there is a misconception that when treatment is over, that there's this sense of relief. And what we've heard over and over in our roles as the managers of Woman to Woman is, in fact, it can be a time of great anxiety. And people often feel very comfortable when they're coming regularly and they're being cared for by the medical team and there are eyes on them all the time. And then all the issues you spoke about, they kind of can feel abandoned in a way. So I think it's really helpful to know that that is normal. If anyone is watching this and experiencing that, it is absolutely normal. And in fact, it's so normal that Woman to Woman really wants to make sure that we are there to support patients at every one of these 3 stages: upon diagnosis, during treatment, and beyond. As I mentioned briefly, we try to do that not just through emotional support, but also through appropriate and relevant education. We have a lot of different financial and other support resources. And so Jillian's actually going to talk about some of the specific resources offered through Woman to Woman in more detail right now.
Mm-hmm. So I think I would love to start with the role that Trisha holds is the peer mentors. So we are lucky enough to have 37 volunteers that are all survivors of gynecologic cancer that are available for anything that a woman in treatment might want. So that can be from the point of diagnosis throughout the treatment and beyond. Volunteers are there to talk about anything that a woman might want. And it could be meeting in person. It could be communicating through phone or email or text. It's what the woman prefers. You know, the cornerstone is that unless you've been there, you don't know what it's like. And so our volunteers do know what it's like, and they're there for our women. The next is what Rachel talked about, is the educational piece. Each month, Woman to Woman has about 13 groups that meet virtually. They are on the phone or Zoom. And there's a range. There's educational groups such as gynecologic oncologist joining, talking about how to cope with treatment side effects, to physical education groups, to book club. Those are more educational based groups. We have groups that meet that are for long-term survivors, for women that are 2 years post-treatment, to talk about now what, where are we, how do we live with this history. We have groups for women living with recurrent disease. You know, you've had it once, it's come back. What's the next step? And so we really try to meet women where they are. We're happy to change and offer groups based on what the need really is. Another part of Woman to Woman that we're really proud of is the financial assistance that Woman to Woman covers. It's very important for us that there are no strings attached to receive our financial assistance. Woman to Woman likes to cover and will cover things such as rent or transportation, fertility preservation, groceries, utilities. If we are able to help, we want to. And again, like I said, no strings attached. You don't have to talk to a volunteer or attend a group or have a certain income. If that's something we can offer, we are proud to. Another arm of Woman to Woman that we recently created is that it's a mental health component where we'll cover sessions with a therapist or a mental health provider or an oncology social worker within Woman to Woman for you. And, you know, we think that mental health support is as important during treatment as maybe your actual medical treatment. You know, it's important to have that support, normalize it for women. So those are really the key components. The cornerstone are our volunteers. We also have the financial, we have the emotional, and we have the educational pieces.
Thank you so much. And as you can see, the offerings through Woman to Woman really mirror the themes that all of our speakers talked about today. You hear a lot, especially during Gynecologic Cancer Awareness Month, about the medical part of things, about the symptoms, about the signs, about what the treatment might look like, about the statistics. But as you hear, the psychosocial part is so relevant, is so important, and really needs to be addressed and validated, because every woman who has gynecologic cancer is going to experience some of the issues that were spoken about today. We also really do encourage you, and as Jillian said, anyone who's watching this to just reach out and say, this is what my situation is. I need help. They don't even need to know what that help would look like. Our job is to interpret that and connect with resources. We are nearing the end of our time, so we wanted to end by asking one question to each of our panelists, the same question. So the question is, if there is a woman who is newly diagnosed watching this video right now, what would your one piece of advice be for this woman? Let's do the same order. So Amanda, let's start with you. If you don't mind, we don't have much time, so just on the shorter side, what would your one piece of advice be for this woman?
Be positive. Cancer is not the end of, it's not a death sentence. And, stay positive, keep busy. Yeah, like that's what I've done. I don't know the secret to my keeping, to being where I am today, other than coming to you guys. You guys are a major piece of my life. But just keep positive, keep busy. If you believe in a higher power or your faith, believe in him, pray to him, prayer, and find some sort of support group or come to us.
Thank you so much. You couldn't have said it better. Come to us. We welcome everyone. Trisha, what would your one piece of advice be for a newly diagnosed woman watching this?
I would say to know that you are not alone. This journey can feel lonely. And from the beginning, you hear those words, you begin thinking, who can I share this with? But know that you're not alone, and not to keep it to yourself. So if you can find one person to share it with, and as Amanda has so nicely said, reach out to woman to woman. That was the first one of the early pieces that I did. I didn't think I needed woman to woman in the beginning, and I reached out because I thought, oh, this is nothing. It was something, and I really needed this community. So that would be my genuine piece of advice.
Thank you so much. And this is not meant to be a plug for woman to woman. This is their genuine, we promise, not a paid endorsement. Jillian, what would you say from the professional perspective?
Sure. I would say focus on the here and now. As we discussed, there's a different phases. You'll be in different places. The concerns are going to be different. And so if you're newly diagnosed, focus on the here and now. What do you know? What do you have to do right then and there? Don't worry about when you're in treatment. Don't worry about a potential recurrence. Just focus right where you are. It will all come together. And when you're in the treatment, then you'll have those set of concerns. And when you're post-treatment, you'll have a certain set of concerns. But for right now, just focus on where you are and the information that you have from your team. And as everyone's saying, contact woman to woman.
Thank you so much. This was fantastic. We are nearing the end. Just in summary, again, the message really for any woman that is watching this right now is, as Trisha said, you are not alone. That's actually the motto of our program. Woman to Woman is here to help with these common psychosocial issues, feelings, reactions, stressors that you might be having no matter what stage you're at in your journey, whether you are just diagnosed and you just got the news a little while ago, whether you're right in the middle of treatment, or whether you are post-treatment, however long ago that might be. Whatever you are feeling is normal, and whatever you are feeling is something that we want to help with and support you with. We welcome you all to be part of our community. The information for how to contact Woman to Woman is going to be put up on the screen. We have a website with lots of helpful links and resources. We have an email address that goes straight to both me and to Jillian. We will reply right away, we promise. And there's a phone number. You can pick up the phone and call us. So again, September is Gynecologic Cancer Awareness Month, which is why we're talking about this. But these are issues that affect people every day, every minute, every second of the year. And we want to make sure no matter what time it is for you, where you're at in your journey, the entire Woman to Woman community is here to help you. So thank you all. Most importantly, thank you to our wonderful panelists who spoke so eloquently about a subject you are so passionate about, and it clearly comes from the heart. And thank you so much. Thank you all for joining us today.
Thank you, Rachel.
Thank you.
Thanks, everybody.
Thank you.
Thank you.